Hello, everybody. We're back again. PTC Live. It's Steve Coleman, better known as Stevie B at PTC. And we're here with another exciting guest and another exciting program and information for our viewers. We have with us today Mr. Lee Valentine. Lee is a personal friend of mine. And I just have to say, and I want to apologize, Lee, because you keep telling me that it's been 21 years since I brought you on with me to do a show about your program. But now you have that chance. Lee Valentine is our director of our Radiologic Technology program, RadTech, Radiology, one of our fine health science programs. Lee, how are you?
I'm doing wonderful. Thanks for finally having me. Glad to be here.
Well, Lee, here's your chance, man. Tell us about all the new and wonderful things that are happening in radiologic technology.
Well, radiology is a medical imaging profession. We use ionizing radiation, and people call it X-rays. And we take images of the patient, and we basically provide information for the radiologist, which is a medical doctor. We're called radiologic technologists, and they use the X-rays to help make diagnoses. For every bone in the body, for example, if there's a bone in the body, a patient can break it. Over 200 bones in the body. So when you think about X-rays, most people think about bone fractures. That is one of the big things that we do. We're able to provide information for the radiologist to diagnose things like cancer, any kind of pathological issues with the lung, pneumonia, bronchitis, and so we probably have a lot of different things that we can help them diagnose.
They talk about, one of the things that I've heard is that there are two types of radiology. There's static and then there's dynamic, if I'm not mistaken. What's the differentiation between the two?
Right. So most people who are familiar with radiology, I would probably say they would be familiar with the static part. Static means still. It's really very similar when you take a picture with your iPhone. And so we are in the room with the patient, but when we take the X-ray, it's a still, just a one picture image. So we're in the room with the patient, we position the patient, and when we get ready to make the exposure, we step out of the room behind the control panel and we make the exposure. And so we send those images digitally. So when you get your knee X-ray, your hand X-ray, your foot X-ray, your chest X-ray, those are digital static images. Another thing that we do, probably about 25% of the time, the static, I would probably say around 75%. With the dynamic, that's the live X-ray. Okay. So we're in assisting the radiologist, which is the medical doctor. We do procedures, for example, like upper GIs, barium minimums. We do a lot of arthrogram joint studies, patients with issues with shoulder, rotator cuff, meniscal tears in the knees. If you're an athlete, you're familiar.
Yeah.
But when we do those types of procedures, we actually can see live dynamic movement images of the patient, which is pretty neat.
Yeah, I can identify with that. I've had knee X-rays, hip X-rays, a hip replacement, chest X-rays. Being an athlete, I'm a crash test dummy sometimes, I think, and you just got to go and see those things take place. The brass tacks of what we talk about when we get to talking about our programs at Piedmont Tech, and what everybody wants to know is, what can I do with a degree in radiologic technology? What options do I have from an employment standpoint? And let's just kind of be honest about it. How much money am I going to make? So tell us about where your students are going, what types of places they're being placed in from a professional capacity, and what options are available to them. What's the future look like for RadTech graduates?
Okay, so obviously large hospitals, radiology departments, small facilities. We actually have a lot of our graduates that are employed in smaller type facilities. People may not be aware, if you go to the doctor's cares and the AFCs here in Greenwood, the express cares, a lot of patients don't want to go to the hospital just for their basic x-rays. So they actually employ a lot of our graduates. After our radiology program, our students do have one good thing about our profession is it's very diverse. We have probably an additional 7 or 8 programs that our graduates can specialize in. It ranges anywhere from an extra maybe 3 months all the way up to additional 2 semesters. You may be familiar with programs like mammography. CT is another one. MRI, nuclear medicine, PET scan. And obviously, when you specialize, you make more money. More education equals more income.
Gotta love that. I know you get a lot of questions about safety in the healthcare fields, and in the environment currently, it just so happens that safety is of paramount importance to individuals. Tell us about the safety measures and precautions about radiologic technology. I mean, you hear people say stories about x-rays and getting x-rays into your body and things of that nature. All of the, colloquial and other things that people come up with. Share with us about a field that's so technologically advanced.
Well,
about the safety measures in rad tech.
So you are dealing with radiation. Radiation can be harmful, but our medical imaging field that we're in, it is occupationally safe. It's an extremely safe field. I just took my badge off, but we have to wear radiation monitors. And we're very highly regulated with the state through DHEC, Bureau of Radiological Health, and even under some of the umbrella of like the FDA. The radiation, I don't want patients or the general public to ever worry about radiation. The radiation that we're doing when we're doing these procedures is a very low level. And small amounts of radiation is not harmful. We do have issues with the fetus and pregnant patients. We would not want to do that unless it would be an emergency type situation. But patients never have to worry because the information that we get from using radiation far outweighs the risk of the procedure. We also try to remind patients, radiation therapy, you're using radiation to cure cancer.
Sure.
So, radiation has many beneficial effects. From an occupational standpoint, if you're concerned about radiation going into the field, I assure you that it's very safe. We have protective equipment that we wear. We have lead aprons. Y'all ever heard the analogy, heavy as lead?
Right.
The lead aprons are extremely heavy. And it will actually protect you from anywhere from 90 to 95% of the radiation. Again, we are the technologists working in the field, when they're doing the static x-rays, they don't get any radiation at all. So 75% of the time, but we do have techniques, policies, and procedures that we do use when we are doing the dynamic. We have thyroid collars. The 3 areas of the body that you worry about the most, and maybe I could say 4, your eyes are very sensitive to radiation, your thyroid gland, your reproductive organs, and then the skin's also very sensitive. That's why they tell people to wear, sunscreen when they're out in the sun for skin cancer.
Sure. But when you go into a health science program, when you go into radiology, and those technical programs dealing with healthcare, you want to be sure that you're learning from the best. And I know for a fact that you have always employed some of the absolute best instructors in the field. Tell us about your faculty now, and give us some insight into who's teaching rad tech under your leadership.
Well, so we have 3 full-time faculty, and we have 1 adjunct that's a part-time employee. With the 4 of us, we have over 115 years experience in the field. And I know it's probably kind of telling on our age a little bit, but we have a very diverse faculty, male, female, people of color, and teaching years experience. I think last time I checked, we have around 38 years experience. Actually, just teaching here.
Sure.
I've been here at the college since 2001. I've been in the field myself for 38 years, and so if you come to this program, you can be rest assured that your faculty is dedicated to the students, and they have a lot of teaching experience and a lot of experience in the field. The other thing is 3 of our faculty still currently work in the field. So we're staying up to date and using all the latest and greatest technology.
Well, the next question is going to be pretty obvious then. Or the next topic is going to be pretty obvious. What kind of money am I going to make?
Well, for South Carolina, we're probably looking at a range of around $37,000 to probably $75,000 based on experience. Again, not only can you specialize, some specialty programs you're looking at an additional $2 to $3 per hour. Like, for example, a mammography technologist. That program's only 3 months long.
Okay.
And I don't offer it here, but our graduates do have opportunities to do clinicals in the local area, which is a plus. They're not having to drive. Most of these courses in the specialty program are online, so they're not having to commute. But mammography, for example, would probably be an additional 2 hours for an additional one semester. And the way that typically works, so for every additional $1 an hour you receive, you're talking about $1,000 annual salary. So a couple dollars an hour could be $2,000 or $3,000. If you do those programs early enough and specialize, and you have a long career like myself, it really makes a difference over the next 15, 20 years.
Sure.
And then when you also your education, if you further your education, so I started out here. This is where I began my career in 1982. And I went on, I got my BS degree, I got my master's. 3 of our 4 faculty have masters, and our adjunct employee has a BS degree.
That's excellent. That instills an awful lot of confidence as a student coming into the program. Before we go to some video, I want to talk about the equipment and digital upgrades that you have in your program. So we want to go in and go ahead and talk a little bit about some of the things that you have in terms of your virtual radiology sim lab. Walk us through some of those things. Tell us about some of the new additions that you have, the technological advancements that are part of your program.
Well, all of our faculty are very involved in the program, and we've been very fortunate over this past year that 2 of our faculty have received some really nice equipment from the Perkins program. And when we see the video, you'll see an articulated phantom. That's something new we got for our lab. And actually, you can actually x-ray. Their bones are inside the body. We have a energized lab. We can actually take x-rays. The virtual simulation lab is pretty cool. We're the only state in South Carolina currently that has this technology. We just got it. We're still learning how to use it. We'll be using it in the fall. But basically, it will supplement our instructors that do positioning, preparing the students for clinical. And then in the lab, typically what we do, we have the didactic portion, and then when we do procedures, they go in and we demonstrate, and then we practice, and the students have check-offs.
Sure.
Well, having this virtual simulation lab, they will be able to go home, and it will be like them being in the lab here at the school. And if they want to go in and practice a procedure at 11 o'clock on Saturday night when the campus isn't open. So we're really excited about this new technology. Getting back to the technology component, we're presently most radiology equipment is DR equipment. That stands for digital radiography. On your phone now, all your images are digital, so that's kind of spilled over into the medical profession.
Sure. Well, we've got some footage about your program. Are we ready to cue some footage? we're going to cue some footage so our viewers can see what's going on in the labs and see some of this wonderful equipment. And as this is playing, Lee, why don't you talk us through it and explain to everybody what we're viewing. So we're ready?
So this is one of our labs. We actually have two. The other one, we're hoping to get some new technology. So this is what we call an energized lab. These are two of our full-time instructors. And this is the new mannequin that we have. So students will actually be, when we're doing upper extremities, students will be able to go in and they'll be able to, the instructor will demonstrate. Students will be able to go in and practice, and they'll get their checkoffs, and they can actually take an x-ray of whatever body part. And then one of the big things that a student has to do is they have to learn all of anatomy. And so we'll put the x-ray up there, and then we'll have to tell them, ask them questions about, what bone is this, or what structure is this. So, and this actually is the x-ray machine itself. What this instructor is doing now, she is actually, we also have a skeleton, and she's positioning the patient and getting ready to do a rib x-ray. And so, depending on what body part, we spend a lot of our time training the students on how much radiation to deliver to get a good quality x-ray. So this is the way we would do a chest x-ray. This next piece of equipment here, this is what we use in surgery. Okay, a lot of people don't realize that our radiologic technologists with their eyes in the operating room for the orthopedic surgeons, when they put in pins and screws and nails and artificial knees, artificial hips, we're being their guide. This is an abdomen x-ray. You see a knee x-ray here. You see a pelvic x-ray, a cervical spine x-ray. And then this is the control panel area that I was discussing earlier. That's the parameters they're using, and then that's actually an x-ray of the skeleton that you saw simulating the rib x-ray. And so we spend a lot of our time teaching students how to use radiation safely. Now this is our mobile x-ray machine. We call it our x-ray portable. A lot of patients that are critically ill, if you've been injured in a severe car wreck, you're on a backboard, you're in a C-collar, you can't move. The patient can't stand up. If you're in the intensive care unit and you have COVID and you need a chest x-ray and you're on a ventilator, you cannot come down to the radiology department. It's not safe. So we actually go up to the floor and do the portable. The image you just saw there was simulating a hand x-ray. And this is our simulation lab.
Wow, that's some really, really amazing stuff. Well, where are your students going to work? Where are they going to? Are they all going to hospitals? What are some of the?
It really varies. We get as many students working in the outpatient imaging facilities. Sometimes they tend to like that. If you're a mom with a couple kids at home, and you may not have to. You may want to be home with your kids, and if you get a job at a doctor's care or something similar to that, it's a lot of times it's a day job. You don't have to worry about weekends. You don't have to worry about holidays, even though doctor's care does have evening hours and they do have weekend hours, but it's probably a mix of about 50-50.
Sure. And the types of patients that radiologic technology students deal with?
From birth to death. If we have a lady, a female patient, mom that's delivered a baby early, the lungs have not developed, they go to the NICU. First thing I'm going to do is a chest x-ray, all the way up to the geriatric patients.
Now, I wanted a bit of information that I found really interesting. Was the number of procedures that your students have to actually master to go out and be an effective professional in the rad tech field. What is that number? I just want to be sure that I
So-
read it correctly.
Our students, they're required to do 70 procedures. Now, they actually have to do competencies, which that's 160 to graduate, but there's 70 different procedures that they have to learn how to do. And that's one of the reasons that, our program is a little bit longer.
Wow. When you think about programs that are so involved, there are things that you want to know about these programs that you, going into them, that'll help you from a professional standpoint. So what I want you to share now is a little bit of inside info. What are some of the things about your program that no one would know? Those things that are key selling points and recruiting objectives so that to get people into the rad tech field.
Well, we do more than push buttons. That's the biggest thing. A lot of folks think we just push buttons. We're just taking pictures. A lot of folks don't really realize how close patient interaction we have. It's a very hand-on. We touch our patients. We have to lift our patients. We have to move our patients. It's very physically demanding. We deal with blood. Folks think only nurses deal with blood, and that's a shocker for some. And we'll have to give a patient a urinal. We'll have to give a patient a bedpan if they need it. It's patient care. Patients get sick on us. Patients who are in car wrecks, they could be in an extreme amount of pain. You have to be able to work under pressure, under high pressure. You have to be able to think on the feet. Patients are not always the happiest when we see them in the hospital, and we have all diverse backgrounds. And we basically have to take care of everyone.
Affordability. I know students come in and they go through our admissions process and they go through our financial aid process. But there are some things within the program that you offer to help defray costs as well. Talk about some of your scholarship programs and other affordability options that you have for students who are interested in pursuing rad
Well, I'm
tech.
very impressed with the college. We offer a lot of scholarships, I feel like. And so when you apply for scholarships, they put you in this large pool. So our students, we have two specific rad tech scholarships for our rad tech students. And so, I have 20 students, basically potential, and I know one year we had 4 out of 20 students that got scholarships. But we specifically do have 2, which I think is really good.
I kind of jumped the gun a little bit. I got to that point before I asked another equally important equally important question. Applying to a health science program is a little bit different than applying to come into the college and do an associate in arts program or some of our other programs where students can go in and immediately start their coursework and lead into the technical aspects of it. Health science is a little bit different.
It is.
What is the application process like for a student that is pursuing rad tech as a career choice?
When they initially come into the college, obviously they fill out an application, and hopefully they would declare a major. Once they declare a major, and if it is a health science major, then what we basically do is we require advising at the healthcare center, which is a little bit different from some other divisions. So we have guided pathways, which is a wonderful thing. Guided pathways is kind of like a little recipe book. And the goal of the guided pathways is to get a student in a program as quick as you can and have them graduate on time, which I think is a wonderful thing. But that's the first part. The second part is you actually have a separate application process into the any healthcare program. And so we, in the advising center, in the care plan center, have to get our students' program ready. We require 5 courses that have to be completed before you can actually apply to the clinical part. And those are Biology 210, Biology 211, English 101, Math 102, and Psychology. You have to have a minimum of 2.5 GPA. It is a very competitive process. We only have 20 slots, and we basically take the 20 students in our program that have the highest points. Once selected into the program, you also have to successfully pass a drug test and a background check, and that's basically a requirement for all of our healthcare programs.
That's a lot of information. And just so you know, anatomy and physiology 1 and 2 are the two biology classes.
210 and 211.
210 and 211. I'm sure a lot of people who have been interested in health science programs, those are seem to be two of the scariest classes going into the process.
It's a good indicator of the difficulty levels of the programs, but I will say it does intimidate a lot of people. But if you do well in your biology 210 and 211, you typically are successful in the program. The other thing about the program ready courses I forgot to mention, not only is the GPA requirement of 2.5, but you also have to have a minimum of a C. Now, if you have all C's, it doesn't mean you're going to get in. You might not have enough points, but that is a requirement.
Wow. Well, Lee, that's a lot of information, a lot of very valuable information. Health sciences, where do you see health sciences going 10 years from now, 20 years from now? When you look out there at the landscape of professional careers, I don't see any relaxing going on in health science. I just see that I tend to see it just getting more and more diverse and more opportunities available. What do you see based on your experience?
Well, I meant to mention that in one of the other questions, but there is a shortage nationwide, statewide, for healthcare. If you choose any healthcare program, you will not make a bad decision. So we've got a perfect storm going on in our country. We've got a lot of baby boomers that are getting ready or already started retiring really about 6 or 7 years ago. Mm-hmm. And so there is one of the largest populations in our country is the baby boomer age. And so those folks, after they retire at 65, within 5 to 10 years, that's when they start getting 70, 75. That's when things start breaking down, and you need our services in healthcare. But the other thing is, people in healthcare, there are a lot of baby boomers in healthcare. So I see a shortage for at least the foreseeable future. You will not have trouble getting jobs. And we have a very good placement, and, I can mention our outcomes or whatever if you're interested.
Well, Lee, thank you so much. After 21 years, you did a great job.
Thank you for having me.
It's Stevie B at PTC, and this is another one of our fantastic episodes of sharing information about the fantastic opportunities and programs at Piedmont Technical College. We'll be back soon, I'm sure, with another great program and another interesting individual like Lee to come and talk about it. But here we are again, sharing information to change people's lives. It's Piedmont Technical College. It's one of the best places to prepare for your future. I'm Stevie B at PTC, and I'll see you again on PTC Live with more information soon.